Hi everyone, it's Dr. Wendy Fortna here with this week's COVID-19 update for the community of Hanna. Today is Tuesday, May 5th, and the information that I present today will be current as of today. So right now we continue to have one active case in the community of Hanna. I have been asked, what does the community of Hanna mean? What that means for me is our postal code, our T0J1P0. I know that there is one positive case in that postal code. That is the most that I know. I've had a number of you calling the office or during our regular appointments asking for more information about this individual, how they got their particular case, and whether or not they're a risk for our community. So when a person swabs positive for COVID-19, both their family doctor and public health becomes aware, and they do something called contact tracing. They find out when this individual became symptomatic, where they went, and what they did. If that individual has been in close contact with anyone and putting them at risk, that individual is also contacted. If the infected person has not been doing those things, then they remain anonymous, and we follow them up from a health perspective until they get better. So if someone who is a significant risk to the public, let's say a grocery store employee, a physician, a nurse, all the people that encounter this sick person will be made aware that they are at increased risk, and screening will be provided if necessary. Outside of that, we have to respect the privacy of this individual and allow them to get well on their own. I'm afraid that's all I can tell you about this particular case. I think it's important for you to know that there are cases in surrounding communities such as Drumheller. We really can't do anything about that except support that community and continue to use our normal precautions with hand washing and social distancing to make sure that we're not getting infected if we are traveling to those communities. All of you, of course, by now are aware of the outbreak situation in Brooks, and so particularly important that if you are choosing to go to Brooks for commercial requirements, such as grocery shopping, that you are doing so provided appropriate social distancing, hand washing, etc. I've had a lot of people asking me about what it means now that we're opening up our province. Does that mean that they're no longer at risk from COVID-19? Or that we have somehow beaten the disease? And I wish that were the case, but it's not true. It's important that you know that we do not have a cure, we do not have a treatment, and we do not have a vaccination for COVID-19. What we do have is a curve that has been flattened so that our resources in the medical community can support the cases of COVID-19 that we have and could potentially support a few more. That is why we are opening up right now to various tasks, most importantly to other health professionals such as dentists, whom we've all been missing greatly. But we are still very much at risk, and it's still very important that you take precautions through social distancing, hand cleaning, and making sure that you're not sort of putting yourselves or vulnerable people at risk. There was an unusual question that came up about child custody situations. So for me, this means where parents are separated or divorced, and there are children who are not able to maintain social distancing. There's no reason at this time why those children cannot continue to live sometimes with mom and sometimes with dad. Somebody asked specifically, what if they're not maintaining social distancing when they're with a particular parent? I would say that that is our legal obligation, that when we are outside of our home or family unit, that we are practicing social distancing. If someone is not doing that, I would get a custody lawyer involved. But there is no reason, even if, say, mom works outside the home, that she cannot still have part-time custody of the children, and same with dad. You do not have to isolate when you move back and forth between mom's home and dad's home, but you still have the requirement that when you're in groups smaller than 15, you're maintaining social distancing. If mom or dad or a child is sick, that situation gets a little bit more complicated, and I would suggest you talk to either your physician or look at the Alberta Health website for more guidance on particular isolation requirements. But generally, everyone well, you can move back and forth without concern. I want to let everyone know that in light of Mental Health Week, in case you haven't heard, we have a new registered psychologist who is working with the Primary Care Network out of the Hanna Medical Clinic, among others. Her name is Carla Turnquist. And if you wish to access her services, you need a referral from your family doctor, but she will be available 1 day a week right now by phone and moving forward for in-person counseling appointments. Our clinic staff are all healthy, as are our physicians, all 4 of us, so all of our services are up and working. We still are doing only 1 office per physician, so there are slightly longer wait times as we clean between patients. Please continue to be kind if we are running behind. The hospital is open. People have been listening and going for the appropriate things. We continue to have visitor restrictions up at the hospital, as well as restrictions on accessing lab and diagnostic imaging. So even if you are seeing a specialist and they sent a requisition for you up to the hospital to get lab tests done, you are still required to book appointments in order to make sure that our waiting room has 1 person only at any given time. The information for the website and the 1-800 number for booking will be available in the text with this video. You will also note that the symptom list for COVID-19, as per Dina Hinshaw, has expanded, which means that now the list of symptoms that requires isolation is as follows: fever or chills, new or worsening cough, new shortness of breath or worsening shortness of breath, sore throat or pain with swallowing, and a stuffy or runny nose. This is going to create some challenges given that we are in allergy season, but please do respect the recommendations that people with those symptoms isolate for a minimum of 10 days or until the symptoms have resolved, whichever is longer. There's also expanded lists of symptoms which make you eligible for testing. Those are available on the Alberta Health website, but definitely if you have questions, you can still contact the medical clinic and talk with the nurse or with your physician. Thank you so much, everyone, for listening. I look forward to your feedback and your questions, and I will update you again next week.